Hi, today we are going to talk about a very common procedure or a combination of procedures which we do in our practice regularly. This is mommy makeover surgery. According to our statistics, every mother in this planet, if they want to look and feel good with all the body parts of their body after they have had given birth to their kids, they would need some sort of a mommy makeover surgery. Hi, I'm Dr. Rajat Gupta, and I'll be clearing you 7 different concepts or 7 things you should know about mommy makeover surgery. So if you are considering this surgery, or if you want someone in your family, or if you know someone in your family who is considering this surgery, please watch this video because I'll be clearing 7 different things about mommy makeover surgery which you should know. Number 1, what is mommy makeover surgery? Mommy makeover surgery this term is a very casual term, a layman term, but used very commonly in our aesthetic surgery practice because it constitutes a gamut of procedures which a woman may need after she has had kids and completed her family. This means once the mother has completed child rearing, if she thinks that certain parts of her body has got deformed due to her becoming a mother, and she wants to restore that body part into a much more youthful look, that is mommy makeover for you. The surgeries can be depending upon what our body parts has got deformed, most commonly breast and tummy. So a lot of women breasts become saggy after they have had kids and they have breastfed them. Their breast may increase in size or may also deflate in size in certain cases. That needs a makeover. Their tummy, they may have residual fat or more commonly excess skin. The skin in the lower abdomen gets extended and overhangs, and they will need a body contouring surgery in the form of a liposuction or abdominoplasty in certain cases. That also constitutes the most common step in a mommy makeover surgery. Other than this, they may have some other areas of resistant fat, maybe in thighs, maybe back, brow rolls. Their buttocks may get deflated or they may get increased in size. That needs to be done. Their genitalia may get aged and they would have a patulous vagina, may need a vaginoplasty. Their labia minora may increase in size, may need a labiaplasty. Some women gain a lot of fat around their faces during pregnancies. That can also be corrected. But generally speaking, breast and body contouring are the more common procedures in the complex of mommy makeover surgery. So this is what mommy makeover surgery is. The second important point is, when should a mother consider doing it? A lot of women come to us or approach my clinic and say, I've just had a baby 1 week back, 2 weeks back. Doc, I want to go for a mommy makeover surgery. A lot of women actually approach us also that they're planning an elective cesarean section, and why not do a body contouring at the same time since they're undergoing an anesthesia anyways and they're going in an operation theater. So understand, any aesthetic surgery should be done at least after 6 months of their having their kid. And the reason is, this 6 months after the pregnancy is done is called as a phase of purpurium. The hormones are still raging high, and let them come down. Once the hormone levels are higher, if you do the surgery, there's more chances of bleeding. We don't want that. We want you to heal perfectly with less bruising and less bleeding. So why do you want to take a risk? Let that hormone surge settle down. At the same time, a lot of skin shrinks back to up to 6 months. What we want is let the shrink back naturally as much as it can and wait for 6 months so that we can assess of what needs to be done, what needs to be cut. We can measure and do a perfect job and not do a job which you may do early, but you are not really knowing what skin can shrink back. So it's an unnecessary procedure. Even your assessments get derailed if you do it early. So that's the reason that you should wait for at least 6 months after you have had pregnancy. Third, what needs to be done? As I said, there are a lot of procedures which a mommy makeover constitutes, but what needs to be done for you? That you need to discuss with your surgeon. So meet a board-certified plastic surgeon, or don't compromise on the ability of the plastic surgeon you choose, thinking that someone is cheaper, someone is expensive. Do these procedures once, do it right. So meet a cosmetic plastic surgeon who you trust, discuss with them that these are your issues, and let him or her assess you and then decide what needs to be done. You may not everybody in Mommy Makeover may not need the same surgery. Some would need a more of a body contouring surgeries, a liposuction or high definition liposuction. Some would need a tummy tuck surgeries in their excess skin. Some would need extensive muscle tightening. So see, a lot of women may have gap in the muscles that is called as divertication recti. They would need repair of that. Some would need a breast lift surgery with a breast reduction. They have excessive sagging big breast. Some would need a breast augmentation along with lift. Some would just need a breast augmentation using implants. So depending upon what you need, what are your problems with, please meet the surgeon and then decide. We regularly get calls from some of our people, and they say, "What is the cost of Mommy Makeover?" I can't tell you the cost of Mommy Makeover unless I've assessed what are your needs. So, third, need to meet a plastic surgeon who you trust, discuss what you need, and then plan. Fourth, what all surgeries can be combined. This is very important. We have to understand that the surgery has to be kept absolutely safe. These are elective cosmetic surgeries. No one likes patients to go into intensive care unit and have long risk recovery. I want my patients to walk back home the next day morning and not having a long hospital stay. So we need to make sure that the surgeries which are combined can be safely done. We can safely do a breast and body contouring surgeries together. But along with these two surgeries, can I do a thigh contouring, an arm contouring, and neck contouring? No, it takes a lot of time of surgery. The surgery time gets extended more than 5 to 6 hours. I don't want that, because as you extend the time, the risks get more, as well as you will have more blood loss. So these are the things which you also need to consider when you are considering Mommy Makeover surgeries, that what all procedures can be combined safely. This is very important to keep the procedure safe. Not 100% safe, 200% safe. What all procedures can be combined safely in a day. So this is something which you need to understand and discuss with your plastic surgeon. Fifth is the recovery time. So you see, I get a lot of patients who are living in a nuclear family and they say that I have to go back to work or I have to go back to home and take care of my kids. My kid will jump on me. I will have to take them on my lap. When can we do that? Some people say, no, I have help. I have house helps and I can afford more time of recovery time. So depending upon that, we need to customize the treatment plan according to the social issues which the patient is suffering from. So you need to discuss this out thoroughly with your plastic surgeon so that you can be clear about the recovery time of the procedure or the treatment plan the surgeon makes for you, and accordingly plan ahead. Sixth is surgical art. So you need to know that cosmetic surgery is an art. Everybody wants a good, beautiful body and a breast shape. But can your surgeon deliver that? Discuss these things. So when I discuss, say, a breast surgery with a woman, I always take care about whether they have side boobs, how about the cleavage, if their breasts are falling apart or their breasts are widely placed apart, how to bring them closer, how much close will look good, what is the gap between the clavicle and the breast so that the breast does not pop out in the places, so on and so forth, as well as the inframammary line, the volume and everything. So these finer nuances needs to be discussed so that your result is a work of an art. Similarly, when we talk about abdomen, I discuss about how much amount of muscle tightening is needed, how much amount of skin and fat removal is needed, which is common. But at the same time, what is the location of the navel? What is the position of the navel? What is the shape of the navel they want? Whether they want a vertical navel, whether they want a horizontal navel. What was the original navel when they were in youth? What was the position of the navel? What is the waistline they are desiring? Along with that, do you want an hourglass shape? Do you want a fat graft into the buttocks so that they get a nice hourglass shape? What all surgeries can be done in a single day? Can I operate buttocks and breast together? Then how will they recover? So all these things have to be discussed. Have to understand that cosmetic surgery is an art. And if you believe that you want a result, what it takes to give you that result, you need to discuss this with your plastic surgeon. This was sixth important point. And the last and not the least, when can you see the result? When can you enjoy the result? You can see the result of Mommy Makeover the same day on the same very day, you can see the result and you can appreciate the work your surgeon has done for you. But you will have some swelling, some bruising in the same day, which will increase over the next few weeks, and then will start decreasing. So it's reasonable to say that you will get a near idea of your result by 4 to 6 weeks, but your final results will keep on improving up to 6 months. Your surgeon will tell you certain things, certain steps, certain ideas, certain medicines to follow during your recovery period so that your recovery is faster, smoother, and you get a much better result. This was my attempt to explain you about in gist of Mommy Makeover surgery. If you think that you have more questions about Mommy Makeover surgery, then please connect with us. My team will always be there to help you. I and my team always make sure that we give you scientific advice and help you scientifically to look better, to feel better, always with you. Bye-bye. Take care.